Welcome to the Wellness Dentist Podcast. Join biological and cosmetic dentist Dr. Katie Toe as she explores holistic wellness through trending ideas, real stories, and patient experiences. This podcast will inspire you to make healthy lifestyle choices and take charge of your dental wellness. And now your host, the Wellness Dentist, Dr. Katie Toe.
Welcome to the Wellness Dentist Podcast, Oral Health for Longevity with Dr. Katie Toe. And today I have a super special guest. I know you hear that every time, but because it's so hard to get them on the show, they're busy clinicians, mom, and of course, they are also working on their wellness. That's why they're here to sharing with us, just not what they're doing in everyday life, but also what they are taking care of patients and themselves in everyday wellness. Today, we have the biological periodontist, Dr. Rosalie Gulla. Dr. Rosalie, welcome to the show.
Thank you for having me.
Yes, and I appreciate that because I know how busy you are on a Friday especially. And the number one question I'm asking everyone on the show is, how did you start on this wellness journey?
Well, I would have to say probably back in high school, whenever I learned about what organic meant and just learning about pesticides in our food. So, you know, my brother and sister used to make fun of me because they would come home with regular ketchup, and then I would say, this isn't organic. And then behind my back, they would whisper and they would be like, it's not organic. And then it became a thing. So whenever I graduated from perio, they whispered behind my back in one of the pictures and they were like, is it organic? But that was back whenever I was in high school, which was a very long time ago. So I'm not even going to tell you when that was because it's just going to age me. But now everybody with social media and, you know, the internet and technology in this day and age, everyone is becoming more aware of what all natural, grass-fed, organic really means. And so, you know, I would say the wellness journey for me started back in high school whenever I discovered what organic was.
What did you find out what organic was in high school? And how's that different in 2026 when you realize, oh, what is about organic that you need to learn and change in the way that you choose your food and eat in everyday life?
Back in high school, I would say organic was a little bit more expensive, so I thought it was going to be better. And they said it was better, but I didn't know what it really meant. But nowadays, I know that it means that there's no pesticides in it. And then that brings me on to another I guess, you know, with what the FDA clears as what organic really means and glyphosates, and then knowing all about the farming and what is fed to our chickens and what is fed to our cows and what it means to be grass-fed, what it means to be hormone and antibiotic free, things like that. So it's changed a lot because back then, whenever it was new and I didn't really have the internet to search it up, back then it was probably Ask Jeeves. Right. And then now we have Google where we just go on and, of course, search everything. And, you know, at the click of a button, I can find out whether this is organic or not. And so I would say that would be the difference of what I view of organic now. And now organic is a non-negotiable in our house, which is very difficult because Vietnamese food is very difficult to cook, you know, because there's not a lot of organic Asian ingredients, but people are coming around to it. So it's not as difficult as it used to be.
Yeah. You know, we have people ask in dentistry, like, is this organic? And now every time I hear that, I would think of you. So thank you for that story. And I know that this is a big part of also your professional life because you are not just a periodontist, you the biological periodontist. So share with our audience what's the difference between the conventional periodontist and the biological periodontist.
So this was actually quite a journey for me, being a periodontist. So after I graduated from dental school, I had to do an additional 3 years of residency where I just studied pure periodontics. I read research paper over research paper. I have an entire closet full of papers because it was very difficult for me to read on an iPad or a computer back then. It just really hurt your eyes.
Yes.
So I printed out all of my articles. I read them all. I became the expert in periodontics. So whenever I first heard about biological dentistry, I was like, oh, well, I'm already practicing biological dentistry because the basis of biological dentistry is whole health, right?
Yes.
Making sure that what you're putting in your body is going to be compatible with the rest of your body and that it all works together. But as a periodontist, I'm preserving tooth structure. I'm preventing disease. For example, let's say anyone who has periodontal disease, of course, I'm trying to prevent that, whether it be surgically or not, conventional, without non-surgical or surgical. And so in my mind, I was already kind of practicing holistically, right? So I didn't really think that I had to do a deeper dive into biological periodontics, let's say, because I already believed that, doing a gum graft, for example, I'm regenerating a natural part of a person's body with their own body.
Yes.
It doesn't get more organic than that. If I'm using your own body and putting it back in your own body, it doesn't get more organic than that. So it was a little confusing for me at first. And so, that's how I started weaving it into my practice. Because if I'm already living at home organically, holistically, I try to choose natural products, natural ingredients, things without toxins, then why not bring it into my practice as well?
Yeah. And then you also start seeing patients are living like that at home. And when they come to you and they also asking similar questions, is this material is good for me? Is this procedure that something going to help me with longevity? Because I want to keep my teeth for the rest of my life. And of course, I don't want my gum to go away because you're doing a lot of these procedures on a daily basis. So I think the hot topic right now in dentistry, not just biological dentistry, is titanium versus zirconia.
Yes.
And I've been sharing my point of view with all the dentists that we train and with all the conferences, that stage that I speak on. But I want to hear from the biological periodontists, and people definitely want to hear from you. What are your, take on the zirconia implant versus titanium implants?
So let me just start by telling you how they teach us in school.
Let's do that. Let's go back and do a review.
Yeah. So in school, it does exist. They do teach it to us, but they kind of put it on the back burner. They teach us that it has a high fracture rate, that if we place it, we have to be really careful because there's a chance that it's going to fracture. And once it fractures, after it's been integrated in the bone, it's going to be very difficult for us to remove. So, of course, they put the fear in us already. Right?
About zirconia implant.
Yes. Titanium started because Dr. Albrechtsen placed it into tibia. That's how it started. And then he noticed in the tibia that it was integrating, osseointegrating, which means that the bone was taking it without rejecting it. So, of course, it's going to be the longest studied material, the titanium material, because that's how they started. It has the most research in it. And so with our profession, if we're going to be the top of something, we're going to do it based on research. So whenever you're in school, based on the research, they teach this to us. It has a 97% success rate if you do XYZ. They didn't necessarily talk bad about ceramic implants. They just said that titanium was more studied. They said that, there's a higher fracture rate, and then once it's fractured, it's harder to take out because you would have to drill through the bone, which is completely true, still completely true. So they trained us a lot in titanium. I remember whenever I was in residency, I went to a conference, and it was in Massachusetts, and there was somebody who presented on, at that time, Straumann. Straumann made a one-piece zirconia implant. So whenever you think of the dawn of a zirconia implant, it used to be one piece, which made it very difficult to place because you almost had to do it perfectly. You had no room for error. That was number one. And so think about
and limited restoration
exactly.
ability, because I had to restore that, and I'm like, how do I do this?
Yes, and not every patient is going to be perfect. Their bone is different. And so if you can only place it in one position, it's going to be very limited for me to place it and also very limited for you to restore it.
That's right.
It was very difficult. And so whenever he presented it, he said that on that patient, it did work. But would he do it for himself? No. Would he do it for his mom? No. And he made the point where he was like, well, this was a patient from California and she was very holistic. And this was back then, whenever I was in residency, and everybody was kind of making fun of that, right?
Mm-hmm.
Fast forward till this year, I went to the AAP in Toronto, which is our yearly conference, and Dr. Tarnow did a review on it as well. And then he said that there was this patient, she kept coming in, he kept placing titanium implants, and it kept failing. And then he finally placed a zirconia implant, and it was successful.
Mm-hmm.
And so he presented that,
Yes.
which I think is a big step because Dr. Tarnow is a huge name in
Legend.
periodontics.
Mm-hmm.
Exactly.
Mm-hmm.
But then he followed up, of course, with, but I wouldn't put it in my mouth because it has so many limitations.
Yeah.
Right? Titanium there's hundreds, maybe thousands of companies that produce this titanium implant. There's different structures, there's different shapes to them, so you can fit them anywhere. There's different connecting parts and pieces, which makes it easier for you to restore. So, it's becoming more popular, but I can still see that some periodontists have their hesitation with it. I don't know if that answered your question.
Yeah. No, that's remind me a lot about, how when I was in dental school, and you remember this, they taught us how to place and restore teeth with amalgam, which mean mercury filling, right? So a lot of people don't know amalgam is you mix alloy with mercury liquid and it turns it into amalgam. And now they don't teach that anymore in dental school.
They still do.
In certain school. Okay, I need to make a list of that. But my point is,
terrible.
back in the day, that's all they had, right? And they believe that is lasts the longest, it's strongest, which is true, but that's also means breaking teeth, right?
Mm-hmm.
And then when I remember composite was first introduced long time ago, there's so many dentists said it's too hard, it's not strong enough, it's too technique sensitive, it's not going to work for every patient. Saliva is the enemy of composite, which is all true. But guess what? Dentists are placing composite more than amalgam now. I would say in the 90s percentile, right? And I don't know where you're going to find dentists that placing amalgam unless in a certain practices type, but I have not touched, placing any mercury filling over 15 years.
Yeah.
So I can't believe that people don't really see the difference in this. Is like history. We've done this many times with so many different material. Oh no, that's the work. Let's just keep using it. And then later on we realize that this is much better. Same with electric cars, same with a lot of things that we see, in the environments and all that. So when people questioning about it, I'm like, keep your mind open.
Yeah.
Right. You don't see a lot of cases doesn't mean it doesn't work.
Exactly.
Yeah. And so as a biological periodontist, I also noticed you share with me cases that patient also not compatible with zirconia.
Yes.
So it's not like a one size fit all for everybody.
Yes, it isn't. And I mean, that's kind of like putting a blanket statement that all patients are the same.
Oh.
We know that not all patients are the same. Some people
Nobody gonna say that, right?
No,
when
exactly.
Yeah. But they say that with materials.
Yes, you can't. Yes, you can't say that. So what I'm noticing is that there are some patients who come in with a titanium implant and they're fine. It's not affecting them. We're doing the testing on them and it's not affecting them. And then there are other patients who have all of a sudden developed an autoimmune disease or some type of what do they call it? Not idiopathic, but they're just not sure where it came from or some
no one make the connection yet.
Yeah. And so whenever we say that, I would say that nothing is ever a one size fits all.
No.
Okay. So we cannot say titanium implants are bad. It might be the only option for some people.
Yeah.
Okay. We cannot say that ceramic implants are bad because it might be the only option for some people. I will say that zirconia is usually biocompatible with most people and will be biocompatible with most people with autoimmune diseases and are more compatible with those people. But I wouldn't go so far as to say that it is a one size fits all so that everyone is going to work with it.
Yeah. And I think that patient needs to hear that from, not just their dentist, but also their specialists who placing this every day, knowing that everyone is unique individual and they deserve the personalized care and approach versus said, oh, you know what? All my patients can have titanium, you should too. Or all my patients can have zirconia, so you should too. And so I think that where a lot of false informations, where the assumption that if it's work for all my patients, it should work for you.
Mhm.
And that's the same with anesthetic, the same with composite, the same with cement, the same with anything that we're using in our practice. We tend to not putting that person in that evaluation. Just like, oh, it's work for everybody, it should work. And I know most dentists picking material based on what they like. I like this how this material, especially composite. Oh, I like how this, handling and shade and price
Yes.
and what's available
Mhm.
versus like, oh, I'm put this in this person, they go home with it 24/7. Because I'm always remind people, when you have material in your mouth, it's not something you can take it out unless that's something removable.
Yeah.
But if it's something that in your tooth, in your mouth, it's a 24/7 exposure. And so this exposure not just limited to physical changes. It
Mhm.
could be like emotional changes, energy
Oh,
changes.
yeah.
Like, so we cannot discount the patient when they report that I taste something different
Oh,
or
yeah.
I feel something different. You just have to listen
Mhm.
and realize that maybe this material is not compatible. I
Yeah.
may have to try something else.
Yeah,
Yeah.
yeah, exactly. Like whenever someone comes in and then we see a lot of patients that come in and tell us that their other dentists thought they were crazy,
Oh, that's
right?
killing me.
I know.
Yes.
And it's terrible because it's like I of course don't want to talk bad about anybody, but I will say that it was a huge learning curve for me to get into ceramic implants. I had to take a lot of classes in that. So I think that sometimes you just have to have an open mind, and then listening to our patients and that our mouth is connected to the rest of our body. We're dentists, we are treating the mouth, but the mouth is connected. It's the entryway to everything in our body. So we have to look at it that way.
Yeah.
We can't just treat it as something separate.
Yeah.
And so, if there's something tasting weird, why don't we take a deeper dive? Why can't it be the titanium implant in their mouth or the silver filling, the mercury filling, right? It harbors bacteria. And so, yeah, I would just say, just hopefully everyone can maybe keep an open mind about it. And then on top of that, learning never stops. Right? I had to take so many different classes. I graduated from my residency, which, a little backstory, periodontics did want to add dental implant specialists at the end of our name, periodontics and dental implant specialist. Our board lost the vote on that, so it isn't. But as a dental implant specialist, I had to, after graduating from my specialty, had to continue taking several different courses to learn more about this ceramic implant. Yes. And not just one brand. I went and I took classes over in Colorado for one brand where I met the person, the doctor who created it.
The founder.
This, going, our other brand that we use, he is from Switzerland. So I always tell our patients, like, oh, this is Swiss made, so it's good. Okay. This is from Europe. Yeah. So, it's just kind of thinking out of the box, being open-minded, being more wanting to learn more, taking your own time, of course, investing in your own education on it before you just rule out anything.
Yeah. And I know you're doing your own research because you document the case, you're presenting, you're lecturing, you're sharing cases with dentists that didn't get an opportunity to see these cases in their practice because either the specialist didn't do these cases or didn't believe in it, right? So they send patient to the specialist and the specialist would put in whatever they have in the office versus what worked best for the patient. Yeah. And so for me, when I have a specialist that's open-minded, that's like, yes, this is great for the patient. Because in the end, guys, we are practicing dentistry. Do you understand practicing dentistry? We have not mastered it. We don't know everything about everything. So we're practicing it. And I do believe the study we call N of 1, That means every patient is their own unique study.
Yeah.
And so our job is report those case study,
Mhm.
document it, and listen to the patients and share that with our colleagues.
Mhm.
That's how we learn,
Yeah.
right? That's
Yeah.
how you see cases like Dr. Tarno talking about that case,
Yeah.
right? And we've seen big names in dentistry start saying, if things fail, I'm changing the brand. If things fail, I'm changing the material. So you're noticing it's not just the material. We notice patient got bombarded with toxicity.
Mhm.
In another way, we are sicker than our parents, than our grandparents and great parents.
Mhm.
So
sure.
therefore, anything changes or anything can trigger inflammation
Mhm.
cascade, that's going to be an issue to the body.
Mhm.
So we no longer say, oh, my grandfather have like 5 mercury fillings and he's living to like 92. I should live to 92 if I have all that. Good
No.
luck. That's not going to be a reality, right?
Yeah.
Yes. So we see a lot of that argument
Mhm.
because they actually forgetting who are you treating. Dentists, if you listen to this and medical professional listen to this, you always have to start out the treatment plan with who are you treating? Because that's what Dr. Rosalie was like. Am I treating this patient? Or am I treating that patient? Because I can tell
Mhm.
which one material is work best for them because we do biocompatibility testing.
Yep.
Yeah.
Yeah.
This topic, we can sit here and talk about it
Yeah.
all day.
Yeah. Yeah.
Yeah. But not only that we have a lot of dentists listen to this podcast, we also have a lot of patients are really confused about what's out there
Mhm.
because people making that one statement, one
Mhm.
size fit all.
Mhm.
Everyone had to have this. Everyone had to have that.
Yeah.
And I think it's not fair for the public
Mhm.
to not knowing that if I need it, what worked best for me?
Yeah. Yeah.
Not the neighbor, not someone else on Facebook group or
Yeah.
social, but it's for me. And I went through these questions with my sister,
Okay.
who had root canals removed because of infections and autoimmune, and then my mom who had cancer twice and also have like 7 root canals had to be removed because it's infected. And they always asking the same thing: Can I have it? Right? And then what come down to me is the quality of life. You don't have to have anything.
Mhm.
But if you're going to have something, that's going to improve your quality of life and your health, or it's not,
Mhm.
right? So I hear when you do consultation with the patient, because I have the privilege working with Dr. Rosalie, and I can hear her consultation, and you always put the person first. And I think that's what make your treatment more successful because it's custom to that patient, and you also you actually talk people out of it because they're not ready for it,
Mhm.
right?
Yeah.
Because they're not ready to not eating on that side. They're not ready to go through all that journey,
Mhm.
and they don't understand.
Mhm.
And they think that taking that tooth out or doing that implant with ceramic will help them with their chronic illness, but it's not true.
Yeah. We had a patient that just recently came in and she had a titanium implant failure. So she was very I
Scar, right?
she was. And
Yes.
I didn't even tell you this yet.
Yeah.
So she came in recently and before she got sedated, she wasn't even sedated yet. She said, "Dr. Katie saved my life."
Oh, wow.
Yeah,
Yeah.
she said that. And so, you know, I could have placed a ceramic implant in her. She was biocompatible. But she was so scared, right? And I could have placed the implant. We checked her bone levels. It was a little deficient, but in that case, I could have placed the implant and did the bone grafting at the same time. But she expressed to me how fearful she was. So I talked to her, and, I didn't want to push her. So I said, okay, well, let's just start slow. What we'll do is let's just go ahead and do the bone grafting first. We'll let it heal for 6 months, and then we'll place the implant. A lot of the times, I think people are just in such a rush to get nowhere.
Yeah.
You know what I mean?
Yeah.
It's like almost February in 2026 already,
Yeah.
right? Time goes by so fast. Whenever I tell them it's going to take 3 to 6 months to heal, everyone always, is it going to take that long? And then we finish, and I'm like, hey, remember whenever I said 3 to 6 months? And
Yeah.
look at where we're at right now,
Yeah.
right?
Yeah.
And so with her, it was the right thing to do for her.
Mm-hmm.
I went in there and I bone grafted for her, and it really wasn't a lot of bone grafting, but I knew that that was what she needed,
Mm-hmm.
and there
Yeah.
was no rush. And so we really tailor our treatment to the patient because we need to put the patient first.
Yes. Yes. Not just physical. Like I know you review blood work, you look at all the referral information, the imaging, the 3D CBCT, you're talking to us on every case. Guys, we actually do RAW every week. I don't know any dental team that do that, but we do. So so every Monday night we get together cases and we do RAW together. And for me, I know that we don't just evaluate just the physical. You actually look at her mental state and say, she's not ready for more. This is a good progress. This is good for this patient. So I think that as a provider, sometimes we are so committed to the physical changes, and one the result for the patient is so bad.
Yeah.
Like we're so attached to the outcome.
Yeah.
And we forgot that it's a process.
Yeah.
And wellness is a journey.
Yeah.
Yeah. And the more you rush, the more likely you will, have some failure because you're pushing or you are forcing the process.
Yeah.
So I didn't hear about that case because I know Monday morning Monday night you were like, that's the one I want to talk about.
Yeah.
So
yeah.
that's awesome. And what do you experience when people come in? You've seen this every day on your consult. I only want this. I only want zirconia implant, or I don't want implant. Like you see that in the consult because what they hear from social media or other people, and they come in with like, it's just a fixed mindset. What do you notice after you do consult with them, and like what did they take away from that?
Well, whenever somebody comes in with a wall up like that, it's coming from somewhere.
Yes.
So I never try to force it. I never say like, well, this is what's going to be good for you.
Yeah.
This is the studies. This is what I'm going to place. This is what we do at this office. Why are you even at this office? I never approach it like that.
Yep. Thank you.
Well, whenever they come in, and if they're like that, I know that something happened to them in the past. I know that they had some type of traumatic experience. And that's whenever I'm like, you know what, let's just take a break. Why don't you want that? What happened? And then I just am quiet. And then I let them tell their story. And then whenever they tell their story, a lot comes out.
Yes.
And most of the time, it's not even about the implant. It was maybe about their experience with the person who placed the implant and the reaction that they got from the person whenever it failed. And so, we just have, I sit back and I listen to them and I let them tell their whole story. It's really important for them to feel heard. And then from there, like you said, I just become detached from the outcome. This is not about me placing an implant. This is about them. What is it that they need, right? And so whatever they come to me with, I'll kind of shift gears into that. If it was a traumatic experience, oh, well, we have sedation, right? If it was a failed implant, well, we have biocompatibility. I take it step by step to make sure that they're comfortable. I never just go ahead and say, this is what is, what we recommend. And then, I let them take their own steps. I let them take their time. And then eventually they come around to it whenever they see that we care for them. We want them to feel heard. And, we're ultimately just putting them first, basically.
Yeah, you become the guy and they're the ultimate hero that make the decision based on what they now know that is true or not for their case. Yeah. Because I've seen a lot of patients was like, oh no, there's no way I'm going to get that. And I'm like, yeah, where'd you get that from? Who been feeding you information? What you experience with. So yeah, so I noticed that when people come in and they very, very fixed on something, there's a deeper story than that. And that's why we're here to help. And if you're listening and you said, my dentist doesn't do that, then ask them, like, can I tell the story and can you help me or, guide me?
Yeah.
And so there's a conversation, and we always say conversation bring clarity. And so we love that you do the consult with the patient and really listen to them and treating them not just the mouth connect to the body, but also the physical. And are they in the right mental state or spiritual state to get this done right now? Because not now doesn't mean never.
Yeah.
They can get that done later. Yes, there's some challenges later, but that's when you're ready, you're ready.
Yeah.
So I love that. I love how you interested in organic in high school and then bring now to your professional life every day. But I know every audience that listen to this, they always know I'm asking the guests about their daily non-negotiable in terms of wellness practices, because we cannot just practice wellness at work. We also do that at home for ourselves, for our family. And so what are your 3 non-negotiable that people, can be looking into?
My 3 non-negotiables, I would say number 1 is flossing. It's
such a periodontist answer.
I know. I almost recommend. I'm not even going to say I recommend it. I find flossing more satisfying than brushing my teeth because of the stuff that comes out whenever you
Mhm.
floss. It's getting in between your teeth, it's getting into your gums. And of course, the periodontist is going to say that. My non
Is that
negotiable.
massaging my gum with the floss?
Yes. Yes, it's so satisfying to me, the stuff that
Mhm.
comes out. And honestly, I went into periodontics probably because whenever I was watching hygiene, them removing calculus from teeth for deep cleaning, scaling, root planing,
Mhm.
it's so satisfying. I
Oh.
mean, I'm sure there's some ASMR videos on there, but I will definitely follow whatever page it is. Just removing the calculus. And that's probably actually what got me started in
Mhm.
periodontics and dentistry. But yes, flossing is number one. Number two, I would say, is I wake up every morning and then I meditate before I do anything else.
Love it. Mhm.
I have an app. It's called Insight Timer,
Mhm.
and it's free. You can pay for the upgrade if you want to, but there are a lot of different types of meditations out there.
Mhm.
And I find that whenever I don't meditate in the morning, it's not that my day goes wrong, but it really just helps set me up for the day. You know, it helps me shift my perspective. It helps me give me some mental clarity. It helps me remember what my purpose is,
Set your intentions.
set my intentions for the day. It helps me live with mindfulness, not mindful,
Ah,
but mindful,
so good. Yes.
right?
Yes.
And so I just started that, and well, I've been doing it for a while, but I started what was it, a challenge.
Mhm.
And so it was just getting on in the morning right whenever I do it. And you know how whenever you have a challenge and it shows that you have a streak?
Yes.
At first, it was more about beating that streak than
Mhm.
anything. I wasn't going to let that streak say, oh, you missed it, so you lost your streak. It was more about the streak. But then I realized that it was really helping me through the day.
Mhm.
And so my second non-negotiable is just waking up and then making sure I meditate, even if it's just for 5 minutes, even if it's just spending that 5 minutes to myself. And then my last non-negotiable,
You're doing so many. So right now she's processing to see which one.
I know, but here's the thing. It's because I grew up with so much acne and
Mhm.
breaking out
Mhm.
that I have to wash my face every single night. I don't even I if I go to sleep with makeup on or if I don't drink enough water, I can tell a difference in my skin, and it was maybe trauma from high school or something, but I am very strict with that as well.
Mhm.
So that is another non-negotiable, just, making sure that I have um good hydration for basically for my skincare.
Mhm. Of course,
Yeah.
your skin is a really major, large organ, and so your skin also tell the story of your or status or condition of your health,
Oh yeah.
right? When
Yeah.
you're not having enough sleep,
Yeah.
when you're having a skin issue, there's a gut issue, there's a detoxification issues,
Mhm.
and so no, it's the funny thing, so many guests on this show, no one ever have the same three things. I love that.
Mhm.
There's a takeaway from me. Listen to your three non-negotiable on wellness practices. Number one, I know she's an amazing because a periodontist because I work with her. But knowing when someone obsess about something, that's a good indication that they love what they do.
That's
She
true.
obsessed about deep cleaning and flossing. You're in the right hand. And then the second thing, consistency. Like when someone will like, I need to get that done and I'm going to do it no matter what. That's consistency. That's another thing we're looking for in like leaders and people that's successful at what they do, being obsessed and being consistent. And of course, they deeply care, not just about like the look, but about the root cause why something happened.
Yeah.
Like someone can say, oh, I use that skincare
Mhm.
and that helping with my skin. But you're like, no, I know I dehydrated. If
Mhm.
I'm eating bad or I'm not sleeping, my skin's suffering
Yep.
because you know the root cause.
Mhm.
And so when you're working with someone really kind of looking for those traits, and now you know why I'm working with Dr. Rosalie because I know she's obsessed with not being perfect, but being making progress.
Mhm.
That's why you never stop learning. You
Nope.
always set up for the next, course,
Mhm.
and then you're willing to share that knowledge with others.
Oh,
So
yeah.
we really appreciate that.
Mhm.
A lot of people talking about your presentations at the Wellness Summit last year.
Yeah.
So I know it's a big hit because they want to learn from the specialists that open-minded,
Mhm.
but also doing cases and give them that takeaway
Mhm.
even that's a 1 case or 10 case or 100 case, but you sharing those cases because that's what you've been doing.
Mm-hmm.
It's not about trying to prove a point
Mm-hmm.
or say, prove that this material is better than the other.
Mm-hmm.
You on the stage speaking about this doesn't work for everyone. And guess what? This person actually compatible with titanium, and you have proof for that.
Mm-hmm. Yeah.
So that's really cool.
Yeah.
God, I can talk about this all day. This is like this is like another round for us, right?
Yeah.
So if this topic of periodontist and implant and material, people still want to have more questions.
Yes.
Where do they find you to connect with you, to follow you, to send you DMs? When can they find you?
They can find me on Instagram. My Instagram handle is at the biological periodontist. Send me a message. I love just opening people's minds to this. I think a lot of people are tiptoeing in the waters or starting to discover it, or they're hearing more and more about it, but they just don't know how to get started with it.
Yes.
This sucks because I think that whenever people bring it up, a lot of people make fun of them, right? Or they are thinking that, oh, you don't need to do that. But I promise you, I will not do that. And it's a learning experience. It's a journey for all of us, right? So I would love it if you could just message me on Instagram, and I will respond back.
Yeah, she's super responsive, guys. And the fact that we honor when people are reaching out to us and ask questions. I have more dentists reaching out to me and asking questions about wellness dentistry more than patient, because patient would contact my practice directly. But someone like Dr. Rosalie, who very passionate about, biological periodontics, she's also really answer question from patients and helping you navigate through this. And again, like today earlier, I did a international webinars on wellness dentistry, and people travel not just from city or different state or different city, but also different country, right?
Yeah.
To get this done. Because I remember 10, 15 years ago, I had patients flying out to another country, like to Switzerland, to get this done because they could not find anyone in the US to do this. And so we know more, and we know that patients need to be heard, and we know that there's no way you know everything about everything. So you don't know what you don't know. This is a better way to practice when you treat that patient as a unique individual.
Yeah.
And so stay tuned. I'm definitely going to bring Dr. Rosalie back for a follow-up conversation because she has so many cool cases, guys. Who doesn't want to hear about those cases and so many takeaways? So we will have Dr. Rosalie back. And in the meantime, subscribe, follow her on Instagram at the biological periodontist, and send her DMs, asking her questions, start a conversation, and have your specialist reach out if they don't believe you or they having question, or you have question for them and they don't know where to find the answer, then guide them and send them to Dr. Rosalie. Thank you so much.
You're welcome.
And
Thank
see
you
you
for
at the
having
next episode. Thank you for listening today. Wellness starts in your mouth and includes your entire life. When you understand that, the whole game changes. Come learn more at thewellnessdentist.com. We see you in the next episode. And remember, there is always a reason to smile.